Have you ever reached out to hold your partner's hand, only to sense a hesitation that wasn't there before? Or maybe you leaned in for a gentle touch and saw her flinch, not because she was upset, but because something had changed. If that's ever happened to you, please know you're not alone. And more importantly, it's not your fault. Here's something most people don't talk about. As we age, our bodies and our comfort zones change. And for women, especially, certain types of touch that once felt comforting or exciting can suddenly feel uncomfortable or even painful. But here's the good news: that doesn't mean intimacy has to disappear. In fact, with a little understanding, things can become even more meaningful. One of the biggest myths I've heard over the years is that physical closeness fades just because we're getting older. That's simply not true. What really happens is that the way we connect has to adapt. And when we take the time to understand how the body and emotions shift with age, we can rekindle the kind of closeness that makes us feel truly alive. Today, we're going to gently uncover where many older women want to be touched, where they don't, and most importantly, how to bring tenderness and comfort back into your relationship. This conversation might surprise you and maybe even heal a little bit of distance that's grown over the years. So stick with me, this just might change how you see touch forever. And hey, if you find this kind of honest, respectful advice helpful, feel free to subscribe. I'm Dr. John, and I've been helping seniors live healthier, more connected lives for over 30 years. And this channel, Senior Health Secrets, is here for you. Now ready to continue into the introduction section. Type continue when you're ready. Hi there, I'm Dr. John, and for over 3 decades, I've had the privilege of helping older adults navigate the changes that come with aging. And one topic that comes up again and again, but rarely gets talked about out loud, is touch. Not just the physical kind, but the emotional connection that touch creates. The kind that says, I see you, I still love you, or even just, I'm here. Now, if you're watching this, chances are you've noticed some shifts in your relationship or in your own body. Maybe you've sensed that your partner isn't as comfortable with physical affection as she used to be. Or maybe you're a woman watching this, wondering if it's okay that certain types of touch just don't feel right anymore. Let me reassure you, this is completely normal. As women age, their bodies go through major changes, many of them subtle, but all of them real. Hormone levels drop, skin becomes thinner, nerves become more sensitive, or sometimes less responsive. And emotionally, what feels comforting or intimate can shift. That doesn't mean anything is broken. It means we need to listen more closely to what the body is saying now. In this video, I'm going to walk you through exactly what's happening, why it matters, and most importantly, what you can do about it. We'll talk about where many older women don't want to be touched anymore, and where loving, respectful touch is still deeply welcome. We'll also talk about how to have those sensitive conversations in a way that feels natural, not awkward. By the time we're done, I hope you'll feel more confident, more connected, and more at peace with the changes happening in your body or your partner's. And if you haven't yet, go ahead and click that subscribe button. I share videos every week that are designed to help seniors live stronger, healthier, more joyful lives, because growing older should never mean growing apart. All right, let's get started. To truly understand what's going on, we first need to look at how the aging female body changes and how those changes affect what kind of touch feels good and what kind doesn't. Let's start by understanding the heart of it all, how a woman's body changes as she ages. This might not be something you hear about at the dinner table, but it's something I've talked about with hundreds, probably thousands of patients over the years. And when we understand what's happening inside the body, we can approach each other with more patience, more compassion, and a whole lot more love. One of the most significant shifts for women after menopause is the drop in estrogen. Estrogen plays a major role in maintaining healthy skin muscle tone and even moisture levels in intimate areas. When estrogen levels decrease, tissues that were once soft and elastic can become thinner, drier, and more sensitive. That means areas that once felt pleasurable can now feel sore, raw, or even painful when touched, even during something as simple as cuddling or a spontaneous hug. And it's not just about physical comfort. These changes can impact how a woman feels about her body. I've had many older women tell me, I don't feel like myself anymore, or I used to feel desirable, and now I just feel fragile. That emotional layer adds another level to the physical discomfort, and if her partner doesn't understand what's happening, she might pull away, not because she doesn't love him, but because she's protecting herself from pain or embarrassment. Let me tell you a story. A few years ago, I worked with a couple, Jim and Lorraine, married for over 40 years. Jim told me I don't understand. We've always been close, but now whenever I reach for her, she stiffens up. Lorraine told me she felt guilty. She still loved Jim deeply, but certain touches just felt irritating now, almost like her nerves were overstimulated, and it was heartbreaking for both of them. But once they sat down together, learned what was happening in her body, and adjusted how they approached intimacy, something beautiful happened. They found a new rhythm, a new kind of closeness, one that didn't ignore the changes, but embraced them. So, what can you take away from this? Start by talking. If you're a man, ask, not assume. Something as simple as, "Is this okay?" or "Does this still feel good to you?" can open the door to understanding. And if you're a woman, know that it's more than okay to speak up. You're not being difficult, you're being honest about what your body needs. Another thing to consider is how aging affects more than just intimate areas. As skin becomes thinner and nerves become more sensitive, even a playful poke or squeeze can feel uncomfortable. Think of it this way: the skin that once felt like a trampoline now feels more like delicate tissue paper. It needs a softer hand, a slower touch. And let's not forget the role of medical conditions. Issues like arthritis, past surgeries, pelvic floor problems, or even mild urinary leakage can change how a woman experiences her body. These aren't flaws, they're simply facts of life that deserve kindness, not frustration. So where do we go from here? Well, now that we've talked about why certain types of touch may no longer feel good, let's look a little closer at the specifics where women typically don't want to be touched anymore, and why. It's not about avoiding these areas completely. It's about adjusting how we approach them with gentleness and understanding. Trust me, you'll want to hear this because just one small shift can bring a whole lot of comfort back into your connection. Now let's talk about something a little more specific and a little more delicate. As we age, it's not just that touch changes, it's where we touch that starts to matter more than ever. Over the years, I've had countless conversations with women in their 60s, 70s, even 80s, and I'll tell you something you may not hear. Often, many of them are afraid to say what doesn't feel good anymore. They worry about hurting their partner's feelings. They don't want to seem cold or disinterested. But deep down, they wish their partner just knew that some touches aren't as welcome as they used to be. So let's talk honestly about the places that may become off-limits or uncomfortable for many women as they age, and more importantly, why. Let's begin with the inner thighs and lower belly. These areas often become more sensitive due to hormonal changes and increased nerve sensitivity. And if a woman has experienced any pelvic surgeries like a hysterectomy, or even just regular discomfort from things like bloating or digestion, changes this area can feel tender or tight. What used to be playful or sensual can now feel invasive. A light touch here might make her pull away, not because she's rejecting you, but because her body is trying to protect itself. Next is the vaginal area. This is perhaps the biggest shift for many women. After menopause, vaginal tissue can become much thinner and drier. Without enough estrogen, the natural lubrication that used to be there simply isn't anymore. Even gentle touch can cause irritation or burning. And unfortunately, many women are embarrassed to bring it up. They might avoid intimacy altogether rather than risk pain. Some may have had urinary tract infections or vaginal discomfort in the past, and still carry anxiety around being touched there, even if they miss closeness. The good news: there are solutions, lubricants, moisturizers, hormone treatments, but those are things to discuss with her healthcare provider. For now, what matters most is that if she's hesitant around that area, it doesn't mean she doesn't love you. It means she's trying to navigate a change she may not fully understand herself. Let's move to the nipples and breasts. This one surprises many couples. You might remember how much she used to enjoy being touched there, but with age, sensitivity in the breast tissue can change dramatically. Nipples can become less responsive, or in some cases, uncomfortably sensitive. Breast tenderness, especially around the time of hormone fluctuations or postmenopausal changes, is common. What once was pleasurable may now feel irritating or even sore. Another area many women become sensitive about is the bladder region right below the belly button. If she's ever dealt with urgency, mild incontinence, or bladder prolapse, even light pressure in that area can feel uncomfortable. For many women, this is tied not just to physical sensation, but to emotional vulnerability. She might feel embarrassed, ashamed, or afraid of an accident. And again, this is not about you doing something wrong. It's about her body sending a signal that it needs a different kind of attention now. So how do you respond? With gentleness, with slowness, with patience. Instead of diving in with the same gestures you used 10 or 20 years ago, slow things down. Pay attention to her body language. If she tenses, pauses, or gently moves your hand, that's a signal to check in. Here's a little phrase I often suggest. How does this feel? Or even, do you want me to keep going? It might feel a bit vulnerable at first, but it's a gift, a chance to show her that her comfort matters more than anything else. One man I counseled, Alan, told me that after he learned to ask before touching certain areas, his wife started to relax more. She even became more affectionate because she finally felt safe. She didn't have to brace herself anymore. And in turn, their connection deepened in a way neither of them expected. So don't worry if some of the usual spots are now off the table or need to be approached with care. That's just part of growing older together. It's not the end of intimacy, it's the beginning of a new kind. And here's the beautiful part. While some areas may become more sensitive or off limits, there are so many other places that can still bring comfort, closeness, and joy. Let's talk about those next, the places where touch is still welcome, still meaningful, and maybe even more appreciated than ever before. Now that we've talked about the areas that may become more sensitive or less welcome with age, let's shift our focus to something much more uplifting, the places where gentle, thoughtful touch is still deeply wanted, and often even more appreciated than it used to be. Here's what I want you to remember. Just because the body changes doesn't mean affection has to disappear. In fact, many older women tell me they crave closeness, just a different kind. A kind that says, I care about you, I respect your body, and I'm still here. It's emotional and physical, and when you get it right, it can be powerful. So where do women often love to be touched as they age? Let's begin with one of the most overlooked areas, the back. Whether it's the upper back, lower back, or even the base of the spine, this area tends to remain a comforting zone well into the later years. A slow hand resting on the back while watching TV. A light rub after dinner, even just holding her as she stands at the kitchen counter. These touches aren't rushed or suggestive, they're steady and safe. And they say, I'm connected to you. Another favorite, the face and hair. You'd be amazed how many women, even well into their 70s and 80s, melt when their partner gently strokes their hair or brushes a strand from their cheek. It's a moment of tenderness, and for many women, it reminds them of feeling cherished, especially if they're not used to being touched with that kind of softness anymore. The hands are another beautiful gateway to intimacy. Holding hands may sound simple, but for many older women, it's deeply emotional. Hands carry memories of raising children, of writing letters, of decades of shared life. A gentle squeeze, a thumb circling the back of her hand while you're walking. Side by side, these gestures go straight to the heart. And don't forget the arms and shoulders. These areas often remain responsive to touch and aren't usually as sensitive as more intimate zones. A light hand on the shoulder while passing by. A reassuring rub on the forearm during a conversation. These moments say, I notice you without needing to lead anywhere. They're comforting, grounding. Now, here's something interesting. Many women develop a deeper appreciation for emotional touch that is touch with intention. What do I mean by that? It's when the touch carries meaning beyond just physical contact. For example, hugging her when there's no reason, rubbing her feet while you talk about your day, sitting close on the couch, not to initiate anything, but just to be near her. And I can't emphasize enough how powerful eye contact becomes in later life. It might not be physical touch, but when you look at her, really see her and smile, you're reaching her on a level that's even more intimate than skin. One of my patients once told me, when my husband looks at me like that, I don't care what year it is. I feel 35 again. And don't underestimate the power of playfulness. A wink, a light tap on the knee, a whispered joke while you're out to dinner. These little moments create spark connection and joy, and that emotional safety often makes physical affection more welcome again. You see, it's not about avoiding touch. It's about changing the way we touch, slowing down, focusing more on comfort, connection, and presence, and less on performance or expectation. One of the biggest fears older women have is being touched in a way that feels rushed or goal-oriented. So when your touch says, there's no pressure, just presence, she'll likely respond with more warmth than you might expect. Let me tell you about Doris and Eugene, married 53 years. Doris had become very withdrawn physically. Eugene was frustrated but cared deeply and wanted to reconnect. I suggested he start with simple pressure-free gestures, brushing her hair back in the morning, rubbing her shoulders after she made tea, holding her hand before bed without saying a word. 2 months later, they came back to my office and said, "It's like we're falling in love again." All it took was patient's presence and a gentler kind of touch. So if you're sitting there wondering, what can I do? Start small. A hand on her arm, a light touch to her cheek. No expectation, just connection. And when she responds, even just a soft smile or leaning in a little, notice it. Treasure it. That's her way of saying, I feel safe with you. Now that we've explored where touch is still welcome and often deeply meaningful, let's take it one step further. How do you talk about these changes in a way that brings you closer, not further apart? Because while touch is important, communication is what keeps it alive. Now, this part is so important, and honestly, it might be the most powerful section of this entire video. Because you can know all the right places to touch and all the places to avoid, but if you don't talk about it, if you're not on the same page with your partner, that silence can create distance. And I've seen that distance build up between couples who deeply love each other, but just don't know how to start the conversation. So let's talk about how to open up about physical affection, desire, and comfort without embarrassment, awkwardness, or pressure. First, understand this: you are not alone. Millions of seniors are quietly wondering the same things you are. Why does my partner seem distant? Is it okay that I don't like being touched the way I used to? What if I say the wrong thing? These are very human, very normal thoughts. And that's why starting the conversation with gentleness, not urgency, is key. Here's a simple way to break the ice. Say something curious instead of something critical. For example, instead of saying, "Why don't you ever let me touch you anymore?" Try, "I've been thinking about how our bodies are changing, and I'd love to know what feels good to you now. I want to make sure I'm loving you the right way." See the difference. One sounds like a complaint, the other sounds like care. Or if you're the one who's feeling uncertain about being touched, try something like, "Sometimes my body reacts differently now, and it surprises even me. I'd love for us to figure this out together. No pressure, just understanding." You don't need to have the perfect words. You just need honesty and a willingness to listen. Here's a little story from my practice that might help. A woman named Grace told me that for years she'd been silently enduring physical touch that didn't feel good. Her husband meant well, but he kept trying to connect the same way he always had, without realizing it made her feel tense and even ashamed. One day, she finally said, "I don't know how to say this, but I need us to slow down. I need something softer, something less automatic." That one sentence changed everything for them. And he told me later, "I wish she'd said something sooner. I would have done anything to help her feel safe." You see, many times your partner wants to do the right thing, but they just need a little guidance. That brings me to another tool, the yes, no, maybe conversation. Sit down together when you're relaxed, not during or right before intimacy, and talk about different types of touch. Each of you can say, "Yes, I enjoy this." "No, this doesn't feel right for me anymore." "Maybe I'm open to trying this again, but gently." You'd be amazed at how much clarity and even fun this simple framework can bring. And don't forget, sometimes writing it down first helps. If speaking feels too vulnerable, start with a short note or a shared journal. One couple I know leaves gentle notes in a box by the bed. Little things like, "I loved that hand massage last night," or "Can we try cuddling longer before bed?" It makes the communication feel lighter, less confrontational, and more playful. Now, one more very important point: remove the pressure of performance. Too often, especially for men, there's this silent worry that touch has to lead somewhere. But many women over 60, 70, and 80 say what they crave most is connection, not expectation. They want to know that if they say not tonight, the love doesn't disappear. That closeness doesn't always have to mean sex. So say this out loud: "I'm here for you, not for anything else, just to be close." That one sentence can unlock years of built-up fear or discomfort. And remember, if this feels too hard to tackle on your own, there are professionals like relationship therapists or sexual health counselors who specialize in this for older adults. You're not broken, you're just evolving. And sometimes a little guidance can open up a whole new chapter of love. So now that you know where the boundaries are, where the warmth still lives, and how to speak openly and lovingly about it, the next step is simple but essential. Let's talk about how to rebuild connection, how to bring back that spark of affection step by step without pressure and with a whole lot of love. You've learned about the physical changes, the emotional truths, and how to talk about them openly. But maybe you're still wondering, how do we actually bring back that warmth, that closeness we used to have? Well, you're not alone, and the answer isn't complicated. It's about rebuilding affection in small, meaningful steps. Think of it like restoring an old house. You don't bulldoze it and start from scratch. You polish the floors, fix the cracks, and bring light into the rooms again. That's how we bring love back too. Step 1, create a daily moment of connection. It could be as simple as holding hands for 1 full minute every morning. No phones, no TV, no distractions, just palms together, eyes soft, breathing in sync. This one small habit tells your partner, I see you, I still choose you. Don't underestimate the power of these small rituals. Over time, they retrain your bodies to recognize safety and warmth in each other's presence without needing to jump into anything deeper before you're ready. Step 2, make space for touch without expectation. This one's big, especially for couples where physical intimacy has become stressful or avoided altogether. Try this tonight. Sit side by side on the couch and gently rest your hand on your partner's leg or her hand or shoulder. Let it stay there for a while. That's it. No goals, no pressure, just closeness. And if she's comfortable, offer a light massage, shoulders, feet, or scalp. Again, not as a lead-in to anything else, just for comfort. Many women rediscover the joy of touch when it feels safe, gentle, and generous. Step 3, bring back affectionate language. We often think of rebuilding intimacy as a physical task, but your words matter just as much. Say things like, I love the way you smile when you're reading. You still take my breath away in that color. I feel lucky to be here with you. You don't need poetry, just honesty. These words go straight to the heart and often reawaken emotional closeness, especially in women who've begun to feel invisible with age. Step 4, rediscover playful romance. This might surprise you, but many older couples report that the most fun part of reconnecting physically wasn't the bedroom, it was the flirting. Yes, even in your 60s, 70s, or beyond, you can flirt. In fact, you should. Whisper something silly or sweet while doing the dishes. Send a playful note. Give a kiss on the neck when she least expects it. One gentleman I knew started hiding handwritten compliments in his wife's crossword puzzle book. Every few pages, she'd find a little love note. Your laugh still makes me melt. You're the best thing about my day. After a few weeks, she started hiding notes back. Their whole relationship shifted, all because of a pen and notebook and a little bit of effort. Step 5, celebrate non-sexual affection. Too often, couples fall into all or nothing thinking. But affection isn't just a path to sex, it's its own expression of love. Try cuddling during a movie, stroking her hair while she reads, giving her a warm towel from the dryer when she's cold. These aren't grand gestures, but to someone who hasn't been touched with tenderness in a while, they can feel like fireworks. And finally, step 6, be patient with her and with yourself. Some days will go beautifully, others may be more challenging. That's okay. Intimacy after 60 is less about performance and more about presence. You're not trying to recreate the past. You're building something new, something deeper, something that fits the season of life you're in now. So if you're wondering, can we really reconnect? The answer is yes. Absolutely yes. Not by rushing, not by pretending nothing has changed, but by showing up day after day with tenderness and patience. Try just one of these steps this week. See how she responds. Even if it's subtle, it's a beginning. And that's where every great love story starts again. Now, before we wrap up, let's go over one last important reminder, something that ties this whole conversation together with hope and encouragement. So what's the big takeaway here? Touch, affection, and connection don't fade with age. They simply evolve. And when we learn to adapt with care, patience, and understanding, we often uncover an even deeper kind of intimacy than we had before. You now know where to be gentle, where to lean in, and how to have the conversations that bring you closer. That's powerful. If this helped you, comment 1 below, and if you know someone else who could use this encouragement, share this video with them. You might just change someone's relationship for the better. And remember, it's never too late to rediscover connection. You are worthy of love, respect, and warmth at any age. Until next time, I'm Dr. John. Take care of yourself and each other.